My name's Kerry Brennan-Tovey, as already said, I work at Newcastle University. So today I kind of want to talk a bit about my experience of working with public partners, and I'm going to use three different projects that I've had the honour of working on that have worked with public partners to kind of show my experiences and what I've learnt so far. So my journey so far, so I moved to the Northeast to study physiotherapy at Northumbria University. And I qualified as a physiotherapist in 2016, where I worked clinically within respiratory and neuro conditions for a number of years before I left clinical practice to go back to education and study my MSc, my Masters in Public Health and my PhD in Public Health. And both of those I completed at the University of Sunderland. As I was coming to the end of my PhD, I moved across to Newcastle University, which is where I've been now for the last 3 years now. And we've had the experience of working on a number of projects. So as I mentioned earlier, I'm going to talk about 3 projects specifically. So the first one I'm going to talk a bit about is the evaluation of the NHS funded tobacco dependency service that I was part of the evaluation team. The second is an exploration into the experiences that people that are food insecure and tobacco dependent face when accessing food banks and whilst being tobacco dependent. And then the third one is the project that I'm currently working on, which is exploring those barriers that pregnant women that are living on low incomes face when trying to access maternity services and antenatal care. So I want to discuss first, so these questions are just to help remind me what it is that I plan on saying. So first off, I want to talk about the tobacco dependency service evaluation. So a little bit of background. In 2019, the NHS long-term plan was released, and within that document, it detailed this new NHS-funded tobacco dependency service that the government was hoping to roll out and embed within our acute inpatients, mental health inpatients, and maternity settings. So what this meant was the government had planned that if a service user attended any of those settings and were identified as a smoker, they would receive bespoke treatment by tobacco dependency advisors there and then to help them have a quit. When they were discharged from these services into the community, they continued to receive advice and support to maintain their quit, but from the community stop smoking services. So this evaluation it's still ongoing. It's a national evaluation, and it's been ongoing now for about 3 years. And because of the large size of the evaluation, we've worked with many different collaborators, including universities, VCSE organisations, that's voluntary community and social enterprise. We've worked with local authorities, NHS England, just to name a few. And we're working with 21 NHS trusts now, so it's a really large piece of work. But alongside that, we also work with our public partners. So our public partners, in this case, they termed themselves a public advisory group, or a PAG, and they are 4 dedicated public members who have worked with us from the designing of this project right through to NHS ethics, our recruitment methods, our protocol and study materials. They've worked with us in terms of analysing our data and some of the dissemination activities that we've already completed. They've been involved in every aspect of the project. The public partners that are involved in this project are people with lived experience of tobacco dependency, of having a quit attempt. So they provide us a great insight that we otherwise wouldn't have. Throughout this project, we have also engaged with a number of other public partners through FUSE. Specifically, when we were going through our NHS application, we wanted to speak to as many public partners as we could to really make sure that our ethics application was strong when we submitted that. One of the things I wanted to note about this project, and it's something that both myself and Angela Wern, who also works on this project with me, are really proud of, is that our public involvement has been evaluated by the Investing in Children charity, who completed a dialogue and change evaluation. So this is an independent evaluation by the charity Investing in Children, where they spoke to both myself and Angela over the span of about 9 months. regarding all the work that we've done with our public partners for this project, how they've been involved, how their involvement has led to actions and changes within the project and how that's been implemented. Not only this, did the team from Investing in Children also have a number of one-on-one meetings with our public advisory group, our public members, around their thoughts of involvement, their involvement in our dissemination and our co-authorship activities, and how they felt we had actioned and changed things because of their input. And we were successful in being awarded the Dialogue and Change Award, which is awarded to our public members, and it was, it's something that we're very, very proud of for this project. The second project I wanted to talk about is the Tobacco Dependency and Food Insecurity project. So this project I started working on alongside the larger tobacco project. And this one we were really exploring tobacco dependency within food banks. So we discussed priorities around budgeting, managing finances, the prioritization of needs, and whether or not people have had a previous quit attempt or any kind of plan to have a future quit attempt. Now, this project had unique challenges, as does every project, but primarily this one, this project was entirely focused within those VCSEs, those voluntary community and social enterprise groups. We didn't work with any NHS trusts. We worked with a few local authorities, but it was primarily food aid organisations in the Northeast. So we wanted to make sure that we were using a diverse group of food aid organisations. So we used food banks, we worked with community shops and supermarkets and pay-as-you-fill CAFs. And we also made sure that they were in various different locations across the Northeast, making sure that we were covering rural, urban and coastal areas as well. Similar to the first project I just mentioned, we did again develop a public advisory group of public partners with lived experience of food insecurity and or tobacco dependency. Alongside that, because we were working so closely with these food aid organisations, we felt it was really important that we also have community experts represented in our public advisory group. So we worked really closely to identify who they may be, and we invited 3 community experts. So they were each embedded within a different food aid organisation, and they were able to bring a different insight and a different experience and perspective on the situation. But they also worked very, very closely with those organisations and communities that we were working with on this project. For this project, we've used a number of different dissemination activities that we've worked, again, really closely with our public partners, because we wanted these findings to be disseminated to those with lived experience, to the general public. So with their help, we co-authored an infographic with the help of a lovely graphic designer as well, because I can't draw anything, who designed a lovely infographic, which was a visual representation of our findings and how they are impacting the lives of those who are tobacco dependent and food insecure. So we co-developed that over a number of meetings with our public partners and our community experts. And through the help of our public partners and community experts, we then shared this as widely as we could. And we are still sharing this. We printed large posters that are displayed within the food aid organisations that we worked with. We also provided additional copies to our community experts to share amongst their own networks with other charities and communities that we maybe have not engaged with in this project. We printed smaller ones off that were placed within food banks, food parcels, were placed in the CAF and were placed in the bags of shopping from the community shop. We wrote a blog post, we co-authored a blog post that talked about the infographic as well, and that's on our funders website. Moving forward, our public members and community experts are named as co-authors and have helped co-author our journal paper, which is currently under review. And in the new year, we are going to be developing a podcast it's going to be led by our public partners and community experts, where they are able to share the findings of the study. And this, again, we're hoping to be shared amongst the organisations that play the radios and such in the background, that they'll be able to play this in those settings as people are attending the food bank and the cafe. And then I briefly wanted to discuss the third project for today. So this project is the one that I'm currently working on. So we're working with a Northeast charity called Children Northeast, and we're exploring the barriers that pregnant women who are living on low incomes are experiencing when they try to access maternity care and antenatal services. So this study, we are collaborating with NHS trusts, local authorities, our integrated care board, NHS England, but we are also engaging with approximately 15 VCSE organisations, so 15 charities and grassroots peer support services. And for us, that was absolutely vital to get a large number involved in this study. Due to the nature of the study, we are wanting to look at why women who are living on low incomes are not engaging with their antenatal care in a hospital setting. We felt if we only worked with those hospital settings, we wouldn't capture everyone's voice. We wouldn't capture the voices of those that maybe couldn't afford to attend their appointments. So we spent maybe the first 9 to 10 months of the project developing those relationships and those connections with those VCSE organisations. And because this is a relatively new area for me, I took it upon to do a mapping exercise. So with this, I went away and did a series of internet searches to identify non-statutory organisations, so organisations that provide additional care to women during their pregnancy. So some of the ones we identified were mum and baby groups, breastfeeding groups, pregnancy social groups, baby banks, physical exercise classes for during pregnancy and postpartum. There was also Pilates and yoga. There was loads and loads of different organisations that were available to this population. So I took it upon myself to kind of collate all the information about these different services into one document and then reach out to each of these services, have a series of conversations with them about what it is that they provide women, how do women hear about them, but also talk to them a bit about my study and what we were doing. From that, all of the services we contacted are engaged in the study currently. So they help feed into anything to do with the study, our study materials, recruitment strategies. They're involved in all of that so far. Not only that, a lot of them invited me along to the sessions that they organise and run for women. So I was able to speak to women with lived experience to get their involvement into the project as well. So we are currently still data collecting for this study. We are still conducting interviews, but we have it planned in the new year that we're going to run a series of workshops, analysis workshops, because we've had so much engagement from the voluntary and charity sector. We want to organise a number where we can have the charity partners there and they can help analyse the data with us, as well as having our public partners and those with lived experience also helping analyse that data as well. So that's our plans for the new year. Once our data is analysed and we start thinking about dissemination, again, we want that to be the focus of our involvement with our public partners to make sure that these findings are accessible to those with lived experience. So again, we'll be working with our VCSE organisations to make sure that we are providing them the findings that they can share amongst the women that attend their groups, but similarly also working with our public partners to produce information that is readily available for them as well. So far ideas include, again, a podcast and short video animations, infographics, and just dissemination events that we will host in person. So I just wanted to talk on some key lessons and reflections that I've learned through the few years I've been working with public partners. So my first one is just the importance of this collaboration with our public partners. It's vitally important to our research for their voices to be heard and for their impact on our research projects. That being said, it takes a lot of time to build that trust, and there has to be a level of trust. As you've seen from the 3 examples, I typically do research around very stigmatizing topics, and therefore we need to have a level of trust with the organisations, the charity organisations, and the women with lived experience to make sure that they feel it's a safe space for them to share and engage in our work. The second is ensuring that we give back to the community. Often you'll hear that researchers go into an organisation, they get what they need by speaking to the public partners, by speaking to the charitable organisation, and then they leave. And I think it's really important that we don't just leave, that we share back what we found, we engage them in the future, we make sure that what they've said has been listened to, has been heard, and we've acted upon it. So I think it's really important that we continue to have those conversations and give back to those community organisations. And then my third one, linked very closely to the one above, is open communication with our public partners. It's really important that the conversations aren't just one-sided, that it's not just the researchers asking constantly for things from them, but that they feel that it's a safe enough space for them to approach us, for them to talk to us about things that they've thought about regarding the projects or future research, to make sure that it's a really open and safe space for them to share their experiences with us. And I briefly wanted to touch on two challenges that I have faced whilst working with public partners, and they're very closely linked. But the first one is around this formality of our public involvement. The first two projects I mentioned, around tobacco, we had dedicated public advisory groups with dedicated people. We met frequently, sometimes monthly, sometimes every 2 months. We met using Teams or Zoom. There was an agenda before the meeting, there was minutes circulated after the meeting, and it was very, very formal. However, this last big project I'm working on at the minute, that hasn't been able to work. The women that we're speaking to, a lot of them don't have digital technologies. There's a lot of digital exclusion. They wouldn't be able to attend a Teams meeting. A lot of them have older children, or they are busy at work as they're coming up to maternity leave. There's a lot that they're still doing, so they're unable to engage in having meetings during the workday. Which leads me to the second one, which is around the researcher being very, very flexible. That's this last project. It's very much been around when's best for the woman that I want to speak to, for the public person. So it's very much a case of telephone conversations and text conversations. These often happen outside of my working hours, but it's best for them when their older children are asleep or they have 10, 15 minutes quiet time. So it's that level of making sure that your PPI work is not very, very rigid, but also allows that flexibility of the researcher to really make sure that they're coming towards and meeting the public person. And then my last slide really is just looking ahead. There's two areas that I personally want to really focus on. And the first one is nurturing the connections that I have developed. I've developed connections with loads of different public partners, loads of different VCSE organisations. And I think it's really vitally important that we continue to nurture those connections and collaborations even after that specific project has ended. So making sure that we nurture them and we're working together once the project's finished to think about future projects and future research ideas, and not just saying, okay, thanks, goodbye, and moving on. So that's something that I really want to focus on in the future. And the second is around developing a public advisory network that's specific for women who are trying to be pregnant, who are recently postpartum, but also the VCSE organisations and practice partners that are working in that space as well, to make sure that there's this social element to our public partners that are involved in our research, to have that the other element of support and social outside of what the researcher can provide them. So if you have any questions, please let me know, but otherwise, thank you very much.